cardiopulmonary exercise test, also known as a CPET, is a specialist exercise test which checks how well the cardiac and respiratory systems function during physical exercise. CPETs can be used to diagnose different cardiac and respiratory disorders and understand how they affect the heart and lungs, including heart disease and heart failure. A CPET looks for factors such as dysfunctional breathing patterns, peak oxygen uptake, and exercise-induced asthma. The test involves the patient using either an exercise bike or a treadmill while wearing a mask to measure their breathing and continuing to exercise until they are too tired to carry on or until they experience symptoms such as chest pain or dizziness. Before the test, we'll place sticky electrodes on the patient's chest and limbs. These sensors are connected to computer via wires, and this is what records the heart's electrical activity. We'll also put a blood pressure cuff on the patient's arm to make measurements at specific time points during the test. The patient will continue to exercise, gradually increasing the intensity until they reach a maximal effort. Immediately before and after exercise, a tiny incision is made in the base of the earlobe to analyse, amongst other parameters, the levels of oxygen and carbon dioxide in the patient's blood. The CPET usually takes around an hour and patients can immediately return home and resume their normal activities. The results from the CPET will help us to deliver an accurate diagnosis, personalised care plan and effective treatment.